My name's Adam Edwards, and I'm the Chief Officer of Transforming Communities Together, who are one of the partners involved in this evening. So very warm welcome to you all. We're going to try out a new function tonight as well, and that's the poll function. We're going to ask two questions tonight. The first one, which will be coming up in a minute, is about how confident you feel about the vaccine, and there'll be one at the end of the session about how helpful tonight's session has been. So it'll flash up on your screen, and you sort of click on the choice that you want to make, and then we'll share the results of that. Just to say that whatever choice you make is completely anonymous. It just helps us to kind of gauge how successful the webinar has been. So we're going to kick off with that first poll, which will be coming up on your screen in a second. Just give a few more seconds for people to make their selections on there. Okay, and we'll close that poll now. So there you go. So 91% of people feel confident in having the vaccine, 5% no, and another 5% don't know. So hopefully for those who are unsure, tonight will help with that. So I'm going to hand over to Shaz now, who's our chair for this evening.
Thank you, Adam. I think that poll was a great addition to our event this evening, so thank you very much for sharing that with us. And I'd like to take this opportunity to say a big welcome to you all, and a thank you for joining us this evening for the third in its series, Questions and Answer COVID-19 Vaccinations. And as mentioned, this is our third event. The first was focusing on our South Asian and white communities. The second was focused on our Black communities, and today we are focusing on our sisters and brothers of the Roma, Polish, asylum, refugee, Gypsy and homeless communities. Today's event's been organised by many organisations, one of which is Black Country Healthcare NHS Foundation Trust Equality and Diversity Inclusion Team, J. Carver, the European Welfare Association, and Black Country Near Neighbours, which comes under the umbrella of Transforming Communities Together. And as Adam says, some people here will know me, others won't. My name is Shaz. I'm the Black Country Near Neighbours Coordinator, and I'll be chairing this event today. Now, before I begin to introduce our panel of speakers, I would like to give our partner organisations an opportunity to introduce themselves. So firstly, I would like to ask the BAME coordinator for NHS Equality and Diversity Board, Yasin Mohammed, to introduce himself, please.
Good evening, everyone, and thank you for coming along to this webinar today. It's really good to see you all. So my name is Mohammed Yasin. From the NHS Trust, BAME Community Development Worker, part of the inclusion team. Now, as part of the inclusion team, we address the impact of COVID-19 on BAME communities and vulnerable groups across the Black Country region, and with the overall aim of tackling health inequalities, improving their access to an experience of mental health service provisions, and building capacity within the communities to promote their resilience. The community development team will provide a resource and a supportive link for BAME communities and vulnerable groups regarding community mental health services during COVID by engaging with different faith organisations, BAME voluntary and community organisations, in order to understand the challenges around COVID-19 and to ensure these groups have access to a sound framework of information, guidance, support for their resilience during COVID-19 pandemic. So as Shaz has already mentioned, this is the third in its series, the webinars, and hopefully we have other projects going forward as well. And we will be putting information out with regards to the other events, further events. So do keep an eye out, and so just enjoy the event for tonight, and hopefully there will be a question and answer session during the end. So if you've got any concerns that you want to ask around COVID, please do ask. We've got the professionals here, do ask them. Thank you.
Thank you, Yasin. Quite rightly pointed out there that if you have any fears and anxieties, please feel confident today to ask those questions. If you don't want to ask them verbally, please do use the chat function and put them on there as the event goes. And I will introduce the questions to our panel when it's questions and answers. Our next partner is Elizabeth from the European Welfare Association. Elizabeth will be speaking at a later time. She's one of the panel speakers today, but I would like to give her the opportunity to introduce herself now as well.
Good evening, everybody. It's lovely to be with you. And Shaz, thank you for pulling it together. You're amazing. I need to ask you how you put these new neighbours on your screen. This is really nice and cool. I also wanted to say that, you know, lovely to see you all, lovely to meet you all. Apart from the fact that, of course, we're all sitting in our rooms like I'm in my study, so I'm just desperate to just get out there and you know, like I suppose most of us, if not all of us, really hungry for this face-to-face human kind of interaction. I'm one of the directors at what we call EVA, which is Eve in English, which effectively is a hub for the Polish community in Black Country and Birmingham area. So we run a supplementary school with 400 children on our roll on High Street in West Brom, and with another branch opening in September at Walsall. We also run various projects, community-based projects, and we have just started our campaign around raising awareness about vaccination. So I will share with you tonight our early days of running this campaign, and obviously happy to take any questions that you might have. But essentially what we are trying to achieve together with Shaz and colleagues from public health and local authorities is to make sure that people have got access to accurate information. So yeah, that's all about me, and I'm pleased to see my other director, Agnes, hiding, as well as Patricia, who's the coordinator for Vaccine App campaign. Okay,
then thank you very much, Elizabeth, for introducing yourself. So let's move on then. So to begin with, I would like to, we do have another partner organisation, JCARA, and normally Rupinder, who's the director of this organisation, does be present in this event, but she has sent her apologies today. So moving on, so before I move on, actually, I would like to remind you all that this event is being recorded. So please be aware of that. It will be shared in our social media platforms, both for Near Neighbours and Transforming Communities Together. And also your contributions are highly valuable to us, so please do use the chat function with your contributions, any questions and answers. If your question is for a particular member of our panel, please write their names there so we know that to ask that person to answer your question. So moving on, I would like to begin with asking our previous chair, Councillor Sandra Samuels, who chaired our second event 3 weeks ago, to give her reflections of that event, please.
Just unmuting. Good evening, everyone, and hi. And thank you again, Shaz, our coordinator. Thank you for pulling yet another event together that's going to benefit, for me, the wider community. So I'm Councillor Sandra Samuels. I'm one of the 60 councillors in Wolverhampton, but obviously from the BAME community, and a very pro-vaccine individual, I have to say. So just reflecting back on our Q&A vaccine webinar on the 4th of March, this webinar actually addressed the African and Caribbean community, looking at the faith perspective of the COVID-19 vaccine. The session was aiming to aid the concerns, and there were quite a lot of them, to aid the concerns and for me, the anxiety, the ongoing anxiety around the vaccine. Addressing some of the legacy issues, some of the NHS lived experiences, misinformation, but also some of those conspiracy theories. And I think one of the things that still stands out for me, that was mentioned by our medical officer, was that over 20 million people had been vaccinated with no deaths up to that date, and over 50,000 were actually involved in the COVID trials. and there were no deaths. But I mean, I'm sure you're all aware that since then we've had news about the blood clots that was causing issues, but also to reassure you that the World Health Organization has now come back to us and said that those 30 blood clots that was identified wasn't related to the vaccination, which is for me great news. So the webinar was very well received on the 4th of March, very well attended by our experts and NHS experts and faith leaders. Our esteemed, knowledgeable speakers was from the Ghanaian community, the Somalian community, the African Caribbean community. We also had lead vaccination nurses. We had a local GP with us, and our medical director, of course, from the Black Country in Birmingham West. I think this was an opportunity, the last session was an opportunity to question our specialist on some of the concerns that I believe, for me, has dogged my community. But in summary, because obviously this is only sort of a 3-minute session as such. In summary, for me, we highlighted that most of our religious individuals who had attended, faith leaders, were in favour of the vaccine on a whole. There were still many concerns among the faith leaders of the low uptake among African and Caribbean community, but also among the Asian community. What we established was that deprivation and overcrowding, along with age, was an overwhelming factor that determining some of our deaths from the COVID-19 among our minority communities. We also established that one of the cities in our Black Country, and I used Wolverhampton as an example, it sort of got, we said 35.5% of African Caribbeans and Asian minority groups. And, you know, one of the startling things that I mentioned, because I realized that Shaz is looking at me, so I need to speed up, that our minority groups actually lived in 20% of the most deprived neighborhoods, and that's nearly half of our population in the city. So our faith leaders had agreed to promote the 2 vaccines that was available in Wolverhampton among their faith communities and reassure where necessary and try to improve the vaccine uptake. Since the webinar, we've had 3 to 5 extra sessions, pop-up sessions for the African and Caribbean community, one at the Very Heritage Centre in the heart of Whitmarines. Since then, I've also been vaccinated, and we vaccinated up to 50 residents from the African Caribbean community in a period of 4 hours. So yes, right. It was an excellent event, and I believe that it did benefit our community, and yes, the intake is on the up. So thank you very much, Shaz. Thank you.
That's a great reflection. Thank you, Sandra. It's really nice to hear that you feel that the webinar itself had an impact on the uptake of the vaccinations in your communities. That's great. Thank you very much for that reflection. And please don't hesitate to leave, Councillor Sandra, as much as I'd love for you to stay. I know you have another really important meeting. Okay. So thank you very much for your time.
And I hope this evening goes well. Okay.
Thank you very much, Sandra. Thank you.
Thanks.
Yeah, as previously mentioned, this is our 3rd event, and we have once again thoughtfully invited a great panel of speakers for you today, 2 of which are professionals and the other 4 from grassroots organisations. As mentioned previously, they'll be representing our brothers and sisters from the Roma, Polish, homeless, asylum and refugee communities. So without further ado, I would like to invite our first speaker, who is the Midlands Lead Chief Nursing Officer, Jennifer Pearson, the Chair of CNO Delivery Group in the Midlands. Jennifer, can you just give us an abbreviation of what CNO stands for, please?
Good evening, everybody. Good evening, everyone, and thank you so much, Shaz and Councillor. I'm absolutely delighted to be here. So, abbreviation CNO means Chief Nursing Officer. So we have a Chief Nursing Officer in England who's in charge of the whole of the NHS nurses. She works alongside Boris Johnson in the Department of Health, and she has 2 regional leads in every region, in all 7 regions, and I'm one of the Midlands leads. There are 2 in each region, and I'm the Midlands lead for her strategic BME nursing advisory group. Sorry, did you want me to just carry on?
Yeah, sorry, yeah.
Yeah, sorry.
I didn't ask in the beginning what that stands for, that's why, yeah. Yeah, carry on, yeah.
Yeah, so yeah, it's great to be here again. You know, this work is so important. You're doing a fantastic job. I know some data has been released yesterday, I think, to say that the uptake amongst ethnic minority people has increased since December, and I absolutely believe it's because of the work that we are all doing to increase the uptake. So that's fantastic. So I'll just tell you a little bit about me. I don't have any slides. We just want to keep this informal so that people feel that they are able to ask open and honest questions in a safe space. So I am a nurse. I've been a nurse for I don't know, something like 30 years. I've worked most of my adult life in the health service. I'm dual qualified, so I'm qualified to nurse both children and adults. So I've spent many years doing both. My background was critical care, so I've spent a lot of time as a sister in intensive care. I've been a matron, I've worked in the Department of Health, and I spent 5 years working for the Care Quality Commission, the CQC. So I've been busy inspecting trusts as well up and down the country. So I am absolutely passionate about care, I'm passionate about people, and I'm passionate about equality and fairness. And I said in a meeting yesterday that I think my purpose is to care, and I honestly don't feel ashamed or embarrassed by that at all. I do generally think that is my purpose, and sometimes when you care so much, you sometimes can get quite hurt if you're not careful. But I have got broad shoulders. Working in the health service gives you that. So because of the work I do as the lead for the Chief Nursing Officer Strategic Advisory Group, and I have to say our chair is somebody called Felicia Kwaku, who you may have seen on the news recently. She was awarded with an OBE in the Queen's Honours List recently. So some of the work that we do is centred around lobbying government, influencing policy. So, for example, the parallel review that was done by the Labour Party to COVID, they asked Baroness Lawrence, who you may know is the mother of the late Stephen Lawrence. She conducted an inquiry. She met with all of us to ask us about what we'd heard on the floor, what our experiences were of COVID. So we provide that unique BME perspective, and we are the point of contact for stakeholders, etc. We provide expert advice, and we monitor work. So, for example, when the first outbreak, the first wave hit, I think all of us saw those faces on TV, and those faces, a lot of them looked like mine, and there were a lot of ethnic minority healthcare staff, social care staff that were passing away. And in all honesty, the systems were quite slow to react to this, but we could see there was something that wasn't right. And we galvanised ourselves very quickly. We had engagement events like this, and we spoke to thousands of staff in the health service and social care sector. And what we heard from people was issues around PPE, the fact that masks didn't fit. And it was quite clear that the masks that were not fitting people were exposing them to the virus.
Yeah, can I please ask you to start wrapping up?
Yes, of course. Am I just giving a quick overview before I answer questions?
Yeah, that's right.
So just to let you know, we now know the masks were not designed to fit Afro-Caribbean faces, Filipino faces, that were designed to fit male Caucasian faces. I've been personally impacted by COVID because we've lost colleagues, I've lost an uncle, I've not been able to see my mother in a home for a year and touch her. And professionally as a nurse, I've spent a little bit of time in critical care, so I've seen the stress and the distress. So I now work as a vaccination lead nurse, and I will talk to you about that a bit later, but we are vaccinating thousands of people a day. But again, with everything else, there are inequalities that we need to address, and we need to make sure that everybody that is eligible, that needs this vaccine, which is everybody, gets it and gets the right information to make that informed choice. Thank you.
Thank you very much, Jennifer, for that contribution. And quite rightly, we have seen the inequalities that have surfaced during the pandemic. So thank you for that contribution. Our next speaker is the Chief Medical Officer for the National Health Service, Dr. Masood Ahmed. He's the Chief Medical Officer for the Black Country and West Birmingham CCGs. And today he's going to talk to us about the importance of vaccinations and any other myths and conspiracy theories that he may have come across. I'm sure he will talk about it as well. So Masood, over to you.
Thank you, Shaz, and thank you for inviting me to the third in the series. So I'm the Chief Medical Officer for the Black Country and West Birmingham CCGs, and what that means is that we commission services, so we provide and we ensure that services are there for our population, and our population is about 1.5 million people. I think what we've spoken about today is the fact that actually we have a huge amount of diversity within our population, and that is what gives our society texture and richness and colour. And what's important to realise is that when we use the term BAME, there are certain communities that are easy to recognise because they are either black or they are from South Asia, but actually it covers all of our minority ethnic communities, and that includes the Polish, the Romanians, you know, sort of the Roma community, the travellers, asylum seekers, and so on. And so really the third in the series is this one is really focused on those groups that perhaps we don't always recognise as being in need of those services in perhaps a slightly different way. I think our previous speakers have touched upon a lot of the news recently and the fact that sometimes actually there is hesitancy, and that is being overcome more recently. And I think a lot of that is because we have been engaging with our communities. And so I'm here not really to talk too much, hopefully, but to answer questions and to listen, because I think there's a lot to learn in terms of healthcare systems and what we can do in the future to ensure that we've got better relationships and more trust. And I think that really breaks down into three aspects. One is the idea of convenience, and, you know, do we have the right setups in the right areas so that people can access those services? I think the other is about, oh, my mind's gone. I had the 3 C's, and I've suddenly forgotten, so apologies. Convenience, confidence, and complacency. So confidence really, I think, is about the questions that get asked around misinformation. And so one of the questions I've seen in the chat box is around the ingredients and what are the ingredients. I can't give you all of the ingredients in detail, but what I can say is that there are no animal products. There are no fetal cells within the vaccines. They're suitable for vegetarians and vegans. And all the ingredients that are there have been shown to be safe and effective. And I think that confidence aspect is one where it takes time sometimes to allay the sort of fears and anxieties that our communities may have. And I think we are making progress, but let's not forget that it's step by step. So I think that trust that we build hopefully will come over time. And it's really good to see a number of faces here that have, you know, I've seen in previous webinars and other webinars. And actually one of those discussions came from, that I've had, came from a previous webinar. So Elizabeth, who's here for, and works with a lot of our communities, we met up. And actually one of the productive outputs of that was that we put a bid together for extra funding from NHS England. And actually we included part of Elizabeth's plans to support that. And I think that's part of the key, is that, you know, as a healthcare system, we're not going to solve this problem alone. You know, as healthcare providers, this is a challenge that we share, and equally it's a solution that we have to sort of solve together. In terms of any other question, I'm here to answer those. Apologies for me switching off the video, but I've been having connection trouble, so I'm trying to take it easy on my laptop this evening. But certainly, if there are any questions, if there are any thoughts, any reflections, if there's any advice actually from those that are on here, I'd really welcome to hear those. So thank you, Shaz.
No problem. Thank you very much, Dr. Masood, for that contribution. And yes, when the platform is open for Q&A, you will have, I'm sure, a lot of questions to answer, which is always good to have. So thank you very much for that contribution. We are going to move on to our grassroots organisations now. So I would like to introduce our first grassroots organisation speaker, who I mentioned earlier, who has also partnered with us to have this event for you today. She herself is from the Polish community, and is Elizabeth Cardinal, the founder and director of Europeans Welfare Association, CCIO, in Sandwell, and she'll be sharing with us today her community's perspective on the vaccinations. So Elizabeth, over to you.
Okay, and you have to time me, Shaz, because I can talk for England.
I am, yeah.
So I think what I wanted to do tonight with yourselves is really to share some of the concerns that, and I've got it actually both ways. So there are things I wanted to talk to you about and let you know about us as an organisation and people behind the campaign to support the vaccination programme. I can also show you some of the most common things that we were now faced or have recently been facing, and give you a little bit of statistics and numbers. So just to put things in context, Poland is right at the bottom from, I think, globally, and that data comes from the Office for National Statistics, and it's only the French that are a little bit better than Poles, stating that it's only 28% of population. I think there's now 36 or 38 million Poles in Poland alone, and you know, it's only 28% of Poles that are willing to vaccinate themselves. There are more people being afraid of side effects of being vaccinated than actually getting ill, which, you know, is quite alarming. I've got a tweet from one of our great professional journalists, Jakub, from 9 hours ago, which says that Poland sees over 34,000 new coronavirus cases, 520 deaths in the last 24 hours, the worst day since the start of the pandemic. They went into the next lockdown at the moment. And unfortunately, what's happening within our community is that we live very isolated lives. I mean, a lot of our community are quite isolated, and they often do it by their own accord, which means that people do listen to the Polish television and are hugely affected at what's happening in Poland, what's happening on social media in particular. So what we've started, is it possible, Shaz, to share the screen? Is that okay? If you could allow me to share the screen, I wanted to show you something very briefly. Let me know. Can you see the slide?
I can, yes.
Yeah, brilliant. So what we started at the beginning of this week is a awareness session on the vaccination, and this is what has been put on. So basically what we're trying to do is put a myth versus fact. So we're rebuking those myths, and as a result of that, sorry, I'm just scrolling through the screens. So what we've got, we have been met with an enormous amount of hate and criticism. So people are telling us about things that this is against the will, that those vaccinations have been produced by using the embryos. And so you've got one person comparing it to Auschwitz, which is absolutely appalling. There is also so these are just examples of, and as I said, absolutely dreadful things that people were putting on our social media shortly after we started with the campaign. So my worry now is two ways. We obviously have to deal with a lot of hate on social media. As an organization, that is posing certain issues, but also how do we get to people and get them to understand the actual impact of it all. So it's an open discussion, but yeah, there is lots and lots of education that needs to go into it by the sound and look of it, and what we've experienced only over the last 3-4 days. It seems to me that this task is going to be humongous.
Thank you very much, Elizabeth. Thank you for that contribution. And that is alarming that you've faced such a criticism on your social media platforms, and it just shows that we have got a long journey
Indeed.
there.
Yeah,
and hopefully these kind of webinars and messaging that we are doing, hopefully it will get to your community, and we will see that rise in uptake, fingers crossed. Yeah, so our next speaker is rather special actually. He came to this country as an asylum seeker. He is Spanish speaking, a pastor at, I hope I say this correctly, Nueva Vida con Cristo Church. Brother Jose Galandus, the founder and director of the Place of Nations Christian Centre CIC in Smethwick. So over to you, Pastor. Tell us about what the perspectives of your community and the vaccinations.
Hello, everyone. Thank you for the invite. It's a pleasure being with you guys in here, and hopefully able to share what we have been facing in here in the community. I guess I agree with Mrs. Cardinal, not only the Polish community, but the Latin American community is very hesitant. So I've been seeing the statistics. London is about 300,000 Latin American people. Only 5% of them have been reached. The problem is because some of them don't speak the language. Many of them do not have proper devices where to see what the GP send the messages. It's a big trouble, but it's not only London. Birmingham here is very complicated. So I do encourage the church. I do encourage my students because I work with asylum seekers. But it's not only the Latin American people. We see as I deal with people from China, people from Afghanistan, Pakistan, Kurdistan, Poland, Moldova, Romania. Sometimes the language and the ideas, it's a lot of superstition. It's a lot of fear. And that plays a big concern, because if I try to push it, which I have been, it's challenging for them. You can get told off. You can be say, as Mrs. Cardinal has experienced. So you're not alone, Mrs. Cardinal. Don't feel bad. Okay, we are in the same journey, but we had to keep going. I had to encourage people. So that's why when my wife took her vaccine, I had to let everybody know, listen, my wife took the vaccine. She's still here. She's very happy. She's waiting for her next shot. I'm going next week. I took some of the people that we know to take the shot, to take the vaccine. We made a video. I put it on social media. I put it in a Smethwick page and I share it. Why? Because I want people to know that it is safe. It is safe. And my take is, if you don't want to do it for you, well, think about the other ones. Okay? You have to do it, and you need to do it because it is safe to do it. It's all I can say for now.
Yeah, thank you very much, Pastor Jose. A very strong, powerful message there. I think when we make videos, like when I had my vaccination a couple of weeks ago, that's exactly what I did. I made a video and I put it out into social media, and it really does begin to break those myths and those conspiracy theories that are out there when people see familiar faces in their local communities taking the vaccine. So thank you very much for that contribution. That was great. I'm actually not doing very well with chairing today, I have to say, so I am going to really go through these very quickly. So our next speaker, if I can politely ask that you stick to your 3 minutes, please, I'll be very grateful, is, I haven't jumped the hoop yet, no, it is Mariana, yeah. So our fifth speaker is from the Roma community, Sister Mariana Pramadila, from the Romani Unity Din Angelia CIC. The platform is yours, sister, and please stick to your 3 minutes.
Hello, sister. Nice to meet you all. Hi. So my name is Mariana. I am born in Moldova, so it's over the other side of Romania, over the border. I have Romanian citizenship, hence the association RUDA, which means United Romanians from England, which basically it is for Romanians, Moldovans, from Roma and Gypsy community, everybody who speak Romanian, and not only we're here to support them. I'm gonna get directly to the vaccine. To be honest, we just started doing campaigning on our social media. We're gonna do some more in the coming months. I will totally agree with Elizabeth and with our colleague who was in front. I forgot his name, the Spanish person. Sorry, brother. So I think what we need to do. Brother Jose, yeah. So what I think for us is super crucial, it's that we create the trust relationship with our community, because if people trust me, then they trust the message that I send in my community. And although it's very difficult to meet them face to face, we do a lot of online speaking to them. My colleague who is here as well, Ionut, he is meeting face-to-face people and supporting them with EU settled status. And he's meeting a lot of people from Roma community. There is a lot of reticence against the vaccine. People don't trust that the vaccine can be developed in such a short time. Although my argument will be, okay, guys, we live in the 5G world, you know, everything is so fast nowadays. We adapted ourselves from, you know, working offline into online world. Why wouldn't you trust companies that to do a vaccine in 12 months and so on? I understand that it might not be perfect. And I think this is the message we need to give. And what people, and I had this discussion with my mom as well. My mom just go on Facebook and she informs herself on Facebook. And I said, Mom, there is the Ministry of Health, there is the worldwide organizations. Yes, and so on. So for us, I will, our aim is to get people to get informed on the right platform and to do the type of communication with our sister communities online, because that's really important to see if some community is doing, the other one is doing, then people will start coming up. And just quick one on the blood clots, what really showed me, kind of opened my eyes is when I saw that 1 in 4 women taking contraceptive pills get blood clots, but nobody talks about that. And then we have a couple of cases, you know, about blood clots by vaccine, and everybody just blows up, which is unfair. It's biased. It's not statistically correct, and so on. So that was my last point to make. We need to be informing from the right sources and create trust with our communities. Thank you.
Lovely. Thank you very much, Elizabeth. Some really great points there. Thank you very much. So our final speaker, I think, you know, when I looked into, okay, our final speaker does some amazing work, and that's the only way I can put it. He empowers and supports our brothers and sisters who find themselves homeless by giving them a home and supporting them to gain skills which will help them. He's from the Enterprise Home Group. Brother Paul Watson, over to you. Give us your perspective.
Okay, hello to everyone. It's a real pleasure to be part of this webinar today. I was actually on the webinar on the fish, and I was so impressed by the way that it was conducted and the information. You know, I find myself in a position where I wanted to be part of providing help and support. And that's why I'm here. So I work as the Director of Operations for Enterprise Homes Group. We are a charity within the city of Wolverhampton, and we provide opportunities for the guys and ladies who have impacted through homelessness. Various means and ways people have experienced homelessness. We found that in the communities that we support EA nationals, we support all sorts of different cohorts, there is a very negative perception about the vaccine. So my responsibility here, I'm not an expert, I'm not a clinician. What I am is passionate about what we say we do, is making homelessness history. How do we do that? It's working together, it's about collaboration. And so one of the things that we have signed up to is something called the Community Champions Campaign, working with the local authority, working with other voluntary groups and organisations to support this campaign of providing information for groups to have the right information to make informed choices. So here's my goal to you guys. If you're finding it very hard to get through to communities, align with me, come and talk to me. Let's work together. Let's find out how we can work together, support each other, and actually get the information out to everyone. I will put my email address on the chat. More than happy for anyone to give me a shout, give me a call, and we can talk it through and we can find ways that we can collaborate together. Finally, just to let you know, up-to-date information, as of this week and next week, any eligible over 50s we're able to go into a pop-up event at Aldersley Stadium for a vaccine between 8 AM and 8 PM. That's great news for the city.
Thank you very much, Paul. I'm sure you'll all agree, some great contributions there, both from our professionals and our grassroots organisations.